Hello, welcome to this webinar. My name is Silvia Costa. I'm an analyst based on Lisbon from Argentina, member of the Portuguese Psychoanalytic Society. This is a webinar named Countertransference in Sexual and Gender Diversity, and I will present and coordinate this webinar and present to you, to our colleagues. Wonderful guest, Analia Wald and Oren Gothland. We were kindly invited for the committee of the webinar in the IPA, led by Isabel Silveira and a dear group of colleagues, to reflect on countertransference in the context of sexual and gender diversity. I will read you the structure of our webinar, the rules of interactions, and the dynamic of our presentation. Please, the next one. You will listen the presentation of Oren and Analia, and then we'll present your, submit your question from the Q&A section in the bottom of the Zoom bar. All the questions are anonymous, and our panelists will receive the question that will be filtered for our reception, and then they are able to answer them. The next one. You can use an automatic function of subtitles in the Zoom. They are available in the base of the Zoom bar. Please press the button in the bottom toolbar and say that the button that says CC to enable them in your language. Once enabled, you can customize settings like language and the appearance by clicking the arrow next to the button. Next. Remember that this webinar is being recorded and will be uploaded for the IPA in the IPA webpage and YouTube. You will be sent a link to the recording in the days following the webinar. Each participant can only interact through the Q&A section. Chat and microphone function are not available in the webinar format. Next. Okay, our guest. The first one is Analia Wald. She is psychoanalyst from Argentina. She holds a PhD in psychology from the University of Buenos Aires. She's a training analyst at the Argentinian Psychoanalytic Association and is a specialist in practice with children and adolescents. At the University of Buenos Aires, she's a full professor, an active researcher, and is director of the community-based clinical program within the Faculty of Psychology. She's also a member of the IPA Committee on Sexual and Gender Diversity Studies, and also served on the Gender Task Force of the Latin American Society of Psychology. In addition, she works as a consultant for the IPA Violence Committee. Analia is the English language editor of the recently awarded Revista Caliban from Latin America. Her research and clinical work is centered on symbolization processes in minorized population, including those affected by extreme poverty, gender and sexual diversity, migration, and neurodivergencies. Analia, thank you for being here. We are listening to you. Then start, yes?
I thought you would present Oren first. Shall I go?
Yes.
Okay.
When you finish, I will present Oren for being more.
Okay. Well, thank you so much for the invitation, and I would like to share some ideas. This is, of course, this is work in progress. And well, I'm going to read my my paper. First, I'm going to start by an epigraph by Byung-Chul Han, which goes, the greater the similarity between people, the greater the production. This is the current logic. Capitalism needs all of us to be the same, including tourists. Neoliberalism would not work if people were different. Since Freud introduced the concept of countertransference, the analyst's position has ceased to be thought of as one of aseptic neutrality and has instead been interrogated as a site of subjective implication. Affects, fantasies, previous knowledge, and ideological positions traverse the analyst, and recognizing this has become both an ethical and technical condition of the analytic setting. In this context, personal analysis and supervision are not meant to purify the analyst, but to make them aware of what persists within them. In clinical work with subjects who identify within sexual and gender diversity, the question lies in how the analyst positions themselves in relation to difference, how they are affected, destabilized, or captured by their own ideals, identifications, and certainties. The risk is not ignorance, but the illusion of mastery. The exploration of the manifestations of countertransference in clinical work with sexually and gender diverse people is not aimed at constructing a specialized clinic, but to reflect on how the analyst's desire can orient itself in these encounters. From my experience working with minoritized populations, I have learned that difference is not an identity marker the analyst must tolerate or understand, but a force that unsettles inherited knowledge, clinical automatism, and normative ideals, even in those of us who consider ourselves critical or well-trained. Minoritized subjectivities in terms of sexual, gender, race, or neurodivergent people do not come to be understood, but to be listened to in their own singularities. And this is where countertransference becomes both fertile and risky. What returns in the analyst are not only effects, but also positions of power, identifications, silences, and urges to validate or repair. Perspectivist anthropology, particularly in its Amerindian formulation, offers a valuable lens for thinking about this clinical scene. Rather than assuming a single universal perspective, the we who observes, interprets, or welcomes the other, perspectivism invites us to recognize that each subject is the center of a world, and that what is culture for one may be nature for another. What is symptom for one may be a mode of existence for another. This inversion of the gaze destabilizes the pretense of clinical knowledge imposed from a place of exteriority and compels us to think of transference as an in-between space where positions, languages, and worlds are negotiated. In this sense, the analyst's desire cannot be the desire to comprehend the other through one's own categories, but rather a desire for difference, a desire that allows itself to be affected, that resists reducing the other to what is already known, that is sustained by luck rather than mastery. As in perspectivism, it is an ethics of decentering, not speaking for the other, but allowing oneself to be spoken, but by what in the other resists full translation. Countertransference manifestations between silence and acting out. Countertransference does not only manifest in the analyst's thoughts or feelings, it often emerges through subtle gestures, omissions, and bodily reactions. In clinical work with sexually and gender diverse individuals, these manifestations may be intensified by the analyst's unconscious identifications, cultural assumptions, or unresolved tensions around normativity and difference. What is activated in the analyst prejudices, over-empathies, defenses, normative knowledge must not be denied but held, questioned, worked through. Forgetfulness, dreams involving the patient, moments of confusion, overprotectiveness, or sudden urge to validate or defend the analysand are not mere accidents. They are formations of the unconscious that signal the analyst's implication in the process. Sometimes the analyst may feel a strong sense of guilt, compassion, fear of failure, or anxiety about the patient's vulnerability. These effects, if not recognized and worked through, can lead to acting out, interventions driven by urgency rather than listening, by identification rather than interpretation. Silence too. Sorry. Silence too can be a form of acting out. When the analyst avoids naming what is present, be it discomfort, attraction, fear, or ideological tension, they risk reinforcing the very structures of exclusion that the analysand may be trying to dismantle. The analytic setting becomes a mirror of the broader social silencing of dissident subjectivities. This is particularly evident in the way contemporary erotic transformations enter the consulting room. BDSM, consented practices, sadomasochism practices, the monetization of intimate content on social media, and other emerging modes of sexual jouissance now appear more freely in analytic discourse. This shift has been made possible in part by the decoupling of the category of perversion from the modalities of sexual practice. No longer framed as pathology, these expressions of desire challenge the analyst to confront their own moral codes, aesthetic judgments, and theoretical limits. What returns in the countertransference then is not only affect but ideology. The analyst's frameworks of intelligibility, their thresholds of discomfort, their fantasies of coherence. The analytic task is not to interpret these practices as symptoms, nor to normalize them, but to sustain a space where they can be spoken without capture. This requires a position of ethical openness, one that does not collapse into permissiveness or rigidity, but remains attuned to the singularity of the subject's erotic economy. In this sense, countertransference becomes a diagnostic tool, not of the patient, but of the analyst's position. It reveals where the analyst is caught, where they are too close or too far, where their desire is entangled with their ideals. And it's precisely through this recognition that the analytic act can be sustained. Formation and supervision, spaces for working what persists. The ethical position of the analyst is not a given. It is a construction, a practice, a sustained effort. It is not achieved once and for all through training, but continually reworked through analysis, supervision, and the clinical encounter itself. In this sense, the analyst formation is not only technical, but existential. It involves becoming aware of one's own repetitions, fantasies, and blind spots, especially when working with subjectivities that unsettle normative frameworks. Personal analysis is not a rite of passage, but a space where the analyst has spoken, has been heard, and has encountered the limits of their own knowledge and desire. It is where the analyst has, at least once, experienced what it means to be traversed by the unconscious. And it is from that experience that they can later sustain the position of listener, of one who does not know in advance, who does not fill in the gaps, who does not act out their own urgency. Supervision and/or control analysis are equally vital. They are not only spaces for correction or validation, but for thinking with, for exposing what resists symbolization, for holding what cannot yet be said, especially in work with minoritized populations, Supervision becomes a space to question not only clinical technique, but also the analyst's own ideological investments, cultural assumptions, and affective responses. It is where the analyst can ask, what is being repeated here? What am I defending against? What am I refusing to hear? In this way, formation is not the acquisition of knowledge, but the cultivation of a position that can tolerate not knowing, that can sustain ambiguity, that can remain open to the other's singularity without collapsing into identification or distance. Working with children and adolescents. New normative frameworks and recommendations for comprehensive depathologizing care for trans, travesty, and non-binary people have been in effect in my country since 2012. That year, a law was passed guaranteeing the right to self-perceived gender identity for adults, youth, and children. In the case of children, this right is exercised through their parents or legal guardians, taking into account the principles of progressive autonomy and the best interests of the child, as established in the Convention on the Rights of the Child. The existence of trans adolescents, and especially trans children, implies, in terms of Judith Butler, an ontological crisis. Butler argued that our conceptions of the human depend problematically on the existence of two coherent genders, and when someone fails to comply with a masculine or feminine norm, their very humanity is called into question. I was deeply moved by these clinical encounters, especially because many of these young people arrived at the hospital to the emergency room due to self-harm or suicide attempts. Gradually, the issue of gender and the suffering related to normative environments, families, schools, medical institutions, clinical discourses began to surface. What emerged was a suffering in excess, a suffering that does not originate in the child, but in the gaze that captures, corrects, silences, or overinterprets them. I adopted a militant stance against disciplinary, heteronormative, and pathologizing conceptions. I was exasperated to hear such positions from psychoanalysts. Many have not yet encountered these cases and denied the existence of trans childhoods. Today, I find it important to distinguish my activism and militancy from what is required of the analytic position, as I previously outlined. Clinical questions. Consultations regarding children with cross-gender identifications range from forms of transvestism in very young children, usually under the age of 3, who seek sensations, textures, and shapes through the use of their mother's clothing and objects. In these cases, transvestism functions as a kind of wrapping to neutralize the unbearable pain of separation from the maternal object. This identificatory construction may later acquire a structural character, and the cross-gender identification may become predominant, configuring a transgender presentation. Parents consult because their sons play with dolls, paint their nails, and choose feminine clothing. Quote, I'd like to know if I should just treat him like a girl. The ambiguity is killing me. The way he's so effeminate. He plays with Barbies, likes to wear my high heels, my makeup. End quote. Transgender presentations in childhood seem more related to being a boy or a girl or not being one than to penis envy or castration anxiety. However, after passing through the so-called phallic phase, disturbing experiences may arise in relation to the genitals, insofar as they contradict the self-perceived identity. These feelings intensify during puberty, when patients' level of anguish may rise sharply. Sometimes symptoms of depression and anxiety intensify, and there may be serious behaviors directed at others or oneself, self-harm or suicidal ideation, including psychotic decompensation. Analysts too experience distress at this point. In other cases, puberty does not mark an intensification of psychic pain. The earlier gender variant expression persists, but it's not characterized by extreme discomfort with the body or a need for bodily modification. We do not know in advance whether cross-gender identifications will be disarticulated or reassembled in the course of analysis, becoming a central axis in identity organization. This is not due to a deficit in our tools, but because the paths are singular and childhood gender variation is largely fluid and subject to diverse outcomes. Working with parents in this process is not easy, especially because the path is riddled with uncertainties and social demands for definitions loom large. Even in seemingly innocent questions that carry years of heteronormativity, such as when preschool staff ask which bathroom a child should use. I want to emphasize that in my country, the legal framework allows us to work analytically in accordance with our ethics of the case by case without applying standardized protocols. Sometimes it's the parents who summon us as experts, as if it were possible to anticipate in young children or adolescents whether we are dealing with true trans individuals or future desisters who might one day join the supposed army of the regretful. Normative ideals can lead us to produce greater destabilization in patients, insofar as some identifications may have been constructed to avoid libidinal overflow or psychic catastrophe. Another current challenge is the increasing fluidity in some adolescents. Anti-transgender groups coined the diagnosis rapid onset gender dysphoria to refer to adolescents who request gender-affirming interventions without prior history of cross-gender identification. The diagnosis was quickly challenged and is no longer considered valid in the scientific community. However, I find it relevant to refer to increasingly frequent consultations. One example may be Kay, a 15-year-old. Her childhood and that of her twin brother were marked by episodes of violence from their mother, a situation that worsened during the pandemic to the point of destabilization. She says she was bullied as a child. Quote, "The boys hit us because we were weird, because we were always together, didn't play soccer and had no friends. The boys were mean, the girls bothered us less, they were calmer." She says that this, along with a song she listens to and believes was written for her, led her to ask to be addressed in the feminine and to change her name. The new market of identifications offers young people the opportunity to reinvent themselves when it becomes difficult to sustain previous identifications as a basis for becoming. Sometimes it is a need to break with the past, a rebirth linked to being of the other sex, which does not always occur in visibly problematic adolescents, but it is more common among youth in states of psychic, social, and relational vulnerability, such as those facing marginalization, prejudice, misunderstanding, and family difficulties. We do not always have access to the ways in which gender paths are constructed, and it is necessary to quiet the analyst's drive to know when it does not originate from the analysand. Sometimes symbolic interventions, such as a name change, are sufficient. Other times, adjustments in image, clothing, hairstyle are enough to accommodate the relationship with the other, with desire, and with jouissance. When the demand involves bodily intervention, other questions and discomforts arise. There is a tension insofar as self-perceived identity emerges from a complex process of identification, has a psychic organizing effect, but it's not immutable. A conflict arises between phenomena we might associate with biological self-preservation and the changes required for identity affirmation. When Sylvia Bleichmer, an Argentine psychoanalyst, reworked the notion of self-preservation, she argued that the ego is responsible not only for preserving life, but also for preserving identity. There are terrible times in history when the subject is forced to choose between preserving life or relinquishing core aspects of their identity construction. This was the case for those who, facing the Inquisition or the Holocaust, chose to deny their Jewish identity in order to survive, among many other historical situations. Someone who chooses to preserve their identity by modifying their anatomical configuration is not driven by that drive, but may be giving form to the representational image of themselves. This should not be confused with an intention to harm. Otherwise, we would be reducing human life to a merely biological fact. Legal frameworks are important, and so is the work psychoanalysts do outside their consulting rooms. In my country, people do not need to be assessed or obtain a psychologist certificate to change their names or access treatments. This highlights the importance of the work psychoanalysts do in relation to informed consent. Informed consent should be a process in which an interdisciplinary team ensures that adolescents and parents understand the implication, consequences, and possible expectations of different medical treatments. From the anatomical body as something real and the male-female anatomical difference as an unappealable limit or starting point, to the body as a purely cultural construction, where are we analysts to position ourselves? The question becomes more complex when even biology no longer seems to offer unequivocal answers. The ethics of desire. At the heart of psychoanalytic practice lies a paradox. The analyst must be fully present, yet not intrusive, deeply implicated, yet not captured, responsive, yet not reactive. This paradox becomes especially acute when working with sexually and gender diverse subjects, whose very presence may unsettle the analyst's assumptions, identifications, and ideals. In these encounters, the analyst's desire is put to the test, not as personal inclination, but as a structural function. Lacan's formulation of the desire of the analyst as a desire that does not aim at recognition, mastery, or healing, but as sustaining the space of the other's enigma, is particularly relevant here. It is a desire for difference, not for exoticism or otherness as spectacle, but for the radical alterity that resists assimilation. It is an ethical position that refuses to reduce the analysand to identity categories, diagnostic labels, or narratives of trauma and resilience. It is a position that listens for what escapes, for what exceeds, for what cannot be fully symbolized. This is not a call for a specialized clinic of gender and sexuality, not for a politically correct posture. It is a call to return to the core of psychoanalytic ethics. The ethics of psychoanalysis is not grounded in neutrality as detachment, but in neutrality as work. The work of holding space, of suspending judgment, of interrogating one's own desire. It means to resist the temptation to explain, to validate, or to correct. In a world that increasingly demands legibility, conformity, and coherence, the analytic setting may remain one of the few spaces where the subject can speak from the place of their own opacity and be heard. Thank you.
Thank you, Analia. I keep thinking with this paradoxical position that you present. Maybe the contemporary time, it's a return to origin of the psychoanalysis position. Thank you. Well, I will present the second talk from our dear colleague, Oren Gothland. He's a clinical psychologist I'm a psychoanalyst based in Toronto. He's a part of the IPA Committee on Sexual and Gender Diversity Studies, and currently serves as the National Scientific Chair of the Canadian Psychoanalytical Society. His book, Transsexuality and the Art of Transitioning, a Lacanian Approach, received the American Academy and Board of Psychoanalysis Annual Book Prize in 2015. The book is now being translated into German and was recently the focus of a public lecture at the Sigmund Freud Museum in Vienna in last November. Over the years, he has also been recognized with the Simon Prize in 2016, the Ralph Rothun Award in 2022, and the Miguel Prazos Prize in 2023. His edit volume, Critical Debates in the Transsexual Studies Field in Transition, the Routledge, was the runner-up for the 2019 Gradiva Award. He has two forthcoming books, Gender with Sexuality, Situation for the Psychoanalytic Learning and Gender, and Gender, A Contemporary Introduction. Okay, thank you, Oren. We are listening to you.
Thank you, Sylvia, and thank you for inviting me to speak about a topic that I often speak about and I have great interest in as a concept. The title of my paper is Gender in Subjunctive Mood. Gender has become one of the most volatile signifiers of our time, saturated with political anxiety, charged with libidinal force, and made to bear the weight of conflicts that exceeds it. Gender in this sense, is an emotional situation where these pressures come to appear. For psychoanalysis, this situation is both familiar and unfamiliar. Familiar because meaning that is unstable, knotted with fantasy, and organized by conflict is its everyday terrain. Unsettling because what now comes under the name gender strains the concepts and narratives the field has relied on. From this vantage, the question for the analyst is no longer what gender really is, but what is happening psychically when something called gender is invoked, insisted upon, or refused. What matters is how we listen to the fantasies, conflicts, and demands that gather under this sign. The stance that interests me here is a subjunctive one, the grammar of might have, could be, should have been. It brings into play experience, wishes, fantasies, hopes, and the pressures on belief, what we have to believe to put things together. This constellation challenges the analyst listening. It presses the analyst to ask, what am I listening to? What am I listening for? And what am I listening with? What kind of theories, fantasies, etc. Heard in the subjunctive mood, these questions become a way of listening to how belief is organized, listening to the experience of being with this patient, listening for something other than the confirmation of what I already know, and listening with a theoretical frame that can itself be unsettled. This stance asks the analyst to stay with ambiguity and to resist sealing off what is heard with a quick explanation or diagnosis so that new meaning can be tried out, refused, or taken up again over time in the transference. In this mood, fantasy sets the conditions for meaning that can only be recognized afterwards as moments that could not be thought at the time. What I'm calling gender belongs to this temporality of belated recognition. Over the past several decades, gender, in contemporary theory, has acquired just such a belated history. It no longer names only a binary or something visible, but carries dense psychic meanings. This history is what the clinic inherits and what the analyst inherits through their education, institutional culture, and relations with colleagues. In other words, gender is not only a category, it's a field, one in which the analyst and patient are already positioned before a word is spoken. Within this field, gender operates as a linchpin of psychic life, securing meaning and threatening to undo it. That linchpin is never only interpsychic. It is knotted to the historical forms through which gender has been imagined. In the clinic, gender is enigmatic because this historicity complicates listening. It enters the analytic encounter already saturated with social conflicts, and its significance altered by successive scenes of struggle and imagination. As questions of gender move through the political field, the emotional charge intensifies. The distinction between ideology and psychic life begins to fray, and gender variance is easily cast as provocation. We see this, for example, in what is now claimed as gender ideology, which is a confusion between psychic life and social panic. We carry that atmosphere into the room. Culture, history, training, loyalties, and countertransference includes this charge. Amid the noise of fantasies of gender, we are compelled to think of it kaleidoscopically: political, social, emotional, and aesthetic. What are its pressure points? Where meaning collapses or insists? In what follows, I approach gender as a psychic situation whose historicity, clinical scenes, and political pressure test psychoanalysis' capacity to listen in the subjunctive mood. I begin from Freud's observation that we do not learn from experience, we repeat it. Bion reopens this difficulty when he insists that analysis must still aim to learn from experience, an aim that depends on what he calls negative capability, the capacity to think in the absence of memory or desire. This is not a neutral blankness, but an aesthetic form of waiting in which the mind can bear contradiction without rushing to certainty. Anne Daphne-Bentel, a French philosopher, suggests that such suspicion is not a pause before action, but, and here we can think about the adolescent that presses for action, or the patient that presses for something. It's not a pause before action, but an event in its own right, an intimate time in which a decision has already occurred yet remain unknown. Waiting then becomes a third modality, neither acting nor explaining, but enduring unknowing and letting imagination trouble the mirage of identity. This is the emotional climate of subjective mood that I'm proposing. It's a reverie-like attention that allows meaning to emerge belatedly in its own time. Belatedly is out of sync with the demands for immediacy. We carry an atmosphere into the room: culture, history, training, and loyalties. Countertransference includes this carried weather in a way similar to what Analia Wald was speaking, how she was speaking about countertransference as a field, as an atmosphere that is not just my feelings about the patient, my own fantasies, my own loyalties. I come with my history, my institution, my education, etc. My work with D, a trans man in his mid-30s, returns me to the question of what it means to hear the social as an internalized scene that is externalized in symptom, fantasy, and transference. D says that he's a failed man who can't do anything right. He's too emotional to count on as a real man. What he wants is to be recognized, but what he expects is to be dismissed. When his boss recently referred to him as a drag queen, D lodged a formal complaint, not just against the insult, but against what it meant, that his masculinity had been attacked. Being a man for him is always conditional, at risk of being taken away. I understand D's emotional situation not simply as a response to external transphobia, although of course it can be also that, but it's a site where psychic life and social exclusion intertwined. If transference is where impressions register before they make sense, then this moment for D is already sedimented in feeling. He is helpless, but more than that, he induces helplessness. In our session, I'm cast as someone who cannot understand, whose very presence threatened to repeat the rejection. No one treats me well. It's because I'm trans, he says. This is not just a statement of fact. It is an affective insistence, too real to allow for curiosity. This scene carries the weight of history. A mother who withheld affection, a stepfather who demanded control, but the parents are not in the room, only me. So it's a narrated history in the afterwardness of it. In other words, it's an organizing structure. In the transference, I become the terrible parent, the bad object, the one who can never get it right. The room becomes a space of haunted identifications, where the analyst is not interpreting from the outside, but caught within the very fantasy they're trying to make sense of. There are aspects of this reality that resist understanding and may never be metabolized. But perhaps this is where the work begins, in staying ethically and emotionally with what has not yet been symbolized for him, including what he calls being a man is bound up with, or the very vulnerability and humiliation he disavows. His masculinity is not a calm internal conviction. It is a precarious status that lives in the other's gaze and can be revoked structurally, a structure of vulnerability. D is deeply affected by structures of gender, race, and class that he did not choose, but that shape how he sees the world and how he feels blocked from living in it. Part of what afflicts him is the ideality of culture, the production of masculinity as something he must live up to, but can never attain. Of course, there are elements of envy, lack, intolerable lack, fantasy of lack. But there's also a fantasy of the subject, the way psychic life organizes and sustains this failure. It is not enough to know the facts. Fantasy organizes reality. This failed masculinity is not simply imposed upon him by culture. It is also constructed, maintained, and suffered through unconscious processes that resist thought. These are not simply internal conflicts, but psychic dramas that stage the external world inside and return through displacements, projection, and identification. In other words, I guess what I'm trying to say here are two things, I think, in conversation with Analia paper, in terms of difference, also in the stance of the therapies. I very much appreciate Analia's position of difference as radical alterity between me and the other. However, I also, when we insert the unconscious here, it's no longer just me and the radical other. It's me and my own my own otherness, because there is a structural non-coincidence that is universal, it's structural. And that I think is what the analyst has to, that's the difference, the internal difference that the analyst has to listen to. Um, what are the conflict? Essentially, what I'm saying is that gender is where conflicts migrate and condense, both for the patient, but also from the analyst. So I have to be aware of my own fantasies, loyalties, uh, places of desire. And in this patient, for example, what I'm listening to is not just, I'm not only trying to decenter myself and to see him as a radical other, but I'm also listening to how his own difference is used. In this case, the repetition of something like a persecution is a way of covering up all kinds of mixed wishes. Perhaps also to show how he's suffering because of his parents, to punish the parents and maintain a victim stance. All kinds of fantasies, of course, can come into that. So I'm listening how difference is used, how gender is used. Um, what the scene D presents makes visible is an emotional situation in which an external injury has become internal structure, a way of knowing himself, I'm listening to a transition that cannot yet be metabolized and to a failed relationality play out between us. For now, there is no curiosity, only the insistence of what has already happened. It comes with complaints. But shifting the frame of understanding away from causality, where internal, repetition, compulsion, for example, or external, the paranoia that I'm going to be attacked because I'm trans, towards an attempt to imagine what it feels like for my patient to be a failed man. I encounter the conundrum of unpreparedness or negative capability because I don't yet know what he means by failed man, or gender for that matter. I'm listening to it unconsciously. Um, I I'm confronted with the experience of being affected before I understand. In analysis, both analyst and analysand must bear the weight of an experience before its meaning can be known. Understanding in this way comes as a deferral. As I consider the multiple worlds shaping these experiences of gender, including the idealized figure of masculinity to which no one can measure up, my listening is guided not by explanation, but by proximity, what I call proximity. It means here staying close to the affective pool of this masculinity, to how it organizes a desire, fantasy, and identification, even as it eludes coherence. I take it as a libidinal form rather than a sociological category. I hear in these words not the effects of masculinity, but his unconscious project of becoming something called a man. This project is oriented towards something unstable and ultimately unknowable because the concept of masculinity and femininity in themselves are pliable, which makes them vulnerable to collapse. Their transformability renders them fantasies already structured by failure. Masculinity, then, is not something Diaz failed to achieve. It is something that fails by design. It does not exist outside of the cultural fantasies that animate it in art, religion, literature, and everyday life. So, what does it mean to be a failed man if masculinity has never was never there to begin with? What I'm hearing is not just a complaint, but desire, a desire shaped by something called masculinity, and a suffering that emerges when the fantasy is situated as cause. In this sense, D is using masculinity in his psychic economy to organize loss, humiliation, and hope. And that's what I mean by the idea that, we co-opt, gender co-opts, not that gender has an agency, but we co-opt, or fantasies are migrate to gender and play out there. It's a point of condensation, in other words. Thinking for everybody, not just for the trans. Thinking from this position, my listening is not concerned with locating the causes of these suffering, but with how he searches for them. In the clinic, what I have access to are my patient's constructions of the present. For Klein, projective identification is not merely a defense, but a communicative process in which intolerable affect is lodged in the analyst, demanding to be thought and signaling that something in the original experience was missed and now returns as transference. I'm listening then to experiences that cannot yet be thought because psychic history and its accompanying affects overwhelm and overburden thought itself. Whereas with D, I'm pressed to render a verdict on manhood. With Sam, another patient, an adolescent who identified as non binary, the demand was different to remain a witness without nailing things down. In my session, they described a dream in which a familiar figure arrived in a ritual attire, their mouth covered, naming a costume worn by, quote, by everyone when they entered this role, end quote. When I returned to it, they turned away. The pattern was familiar, seeming approach and then retreat, as if the structure of the dream played itself out in the transference. Sam often performed the engagement, curious, insightful, but without conviction. They would flirt with intimacy only to flatten it, offering childhood stories as if to confirm nothing could be learned from them. In these oscillations, I found myself drawn into the same rhythm, leaning forward with curiosity, then retreating in frustration, uncertain whether my interest would be received as recognition or control. Their suspicion met my own countertransference, the pull to anticipate, to stabilize, to defend against confusion. When some spoke of their university's failed promises and betrayals, I heard them as an account of our analysis. The fear was not only of being misunderstood, but of being taught by someone pretending. They preempted the betrayal by performing it first. When persisted What persisted beneath this oscillation was the need to be loved as an ordinary person, the hunger for contact, and the dread that such contact might undo them. Gender here moved in the tension between pressure and withdrawal, a form tried on, enjoyed, then set aside before it could harden into something unbearable. The work, as I conceptualize it, was not to solve that tension, but to remain inside it with them, letting the refusal of coherence protect what was still forming until it could be approached without fear of collapsing. I'm moving to gender as a threshold. What the case of D gives us is not an origin story of gender, but a formation, a scene where desire, incoherence, and the restless effort to make meaning come together. Stoller's notion of a core gender identity tried to name this insistence that gender lies at the root. I take this core less as an essence than a psychic conviction, forged through repetition and afterwardness, lived as an originary even when it's belated. What feels core is not discovered but composed, a way of managing all kinds of things, losses, relations, saturated with affect and insistence. By the time the patient speaks, the atmosphere is already charged with prior readings, cultural debates, and the analyst's own pressures. So the work of analysis is shaped in this atmosphere, not outside of it. Winnicott names what is then at stake as the idea of using the object, where the survival of the other becomes the condition for psychic life to continue. This is where I locate my adolescent patient, Sam's ruthlessness, not as an attack to be interpreted, but as a demand that I surrender anticipation, withstand disorientation, and remain usable without retaliating. What was at stake was the shift from being a subjective object in Sam's mind to becoming an objective subject available for something unanticipated to take form. In the adolescent imagination, gender moves as a terrain of experimentation, what Freud called sex research, and evasion. To stay with gender as psychic formation, its movements and repetition, calls for attentiveness to the structure that shape our capacity to listen. What desires are permitted to speak and what losses remain ungrievable? These questions point to a psychic economy in which femininity, dependency, and creativity have long been cast as threats to coherence. To transition, to speak, to act, to identify, is to step into that economy and to enter relation, risk disillusionment, and test the limit of recognition. Situations like those described test the analyst's capacity to withstand the pull towards mastery, a pull Eve Kosovsky-Sedgwick helped us think through in her distinction between paranoid and reparative reading. Much discourse on gender operates paranoidally, seeking a buried trauma or origin that would explain everything. Psychoanalysis is vulnerable to the same urge. Yet what appears in the clinic is not a clear chain of cause and effect, but compromised formations, repetitions, identifications, displacements that manage what cannot be directly known. To take seriously the Freudian idea of Nachträglichkeit, or deferred action, is to recognize that what comes into view in the analytic situation is the sedimentation of experience whose significance may only become legible afterward, if not at all. If at all, sorry. Gender, like any psychic formation, is a medium through which conflict becomes metabolized, available to thought. Elsewhere, I've named this temporality an accident, which relates also to the idea of being affected before understanding. The concept of gender in my work has carried a quiet insistence. It is relational, shifting, never fully grasped. I approach it as something that emerges in situations when a subject thinks about it, is addressed through it, or is subject to its demands. What returns from early object relation is not simple history, it's affect, repeating across time and shaping experience. In this sense, gender bears Nachdeglichkeit, meaning arrived belatedly, and fragments are reworked into changing patterns of recognition and refusal. Feminine and masculine elements move through something we call gender as structuring instability, shaping how it strains, disperses, and endures, never containable in a single figure. In this view, I treat sexual difference not as a fixed opposition. It is rather a tension. It's a conflictual place, a potential space that brings identity into being. In the psychoanalytic clinic, coherence slips across bodies, speech, and the tonal current of the analytic scene, where intimacy and classification press against each other, the demands to meet the patient in their singularity rubbing up against the pull to place them in familiar categories. It is in such scenes that gender is experienced as belated and contingent, taking shape as the boundary where one's experience meets the other's presence, gaze, or response. Such moments call for a particular kind of presence, the willingness to tolerate not knowing and to leave the encounter open rather than saturated with explanation. An adolescent that says, I might be a boy, a patient that lives as a woman but dreams in another voice. These are moments of becoming marked by ambiguity rather than failure. I call this a subjunctive mood, an aesthetic ethic that unsettles familiar forms by delaying conclusion and allowing deviation. In this mood, we listen, of course, for defenses like idealization, omnipotence, splitting, but also for what else is being attempted, what is trying to come into being, a kind of positive hallucinosis in a Bionian sense, where the mind hallucinates a meaning or object not yet available. Rooted in waiting and negative capability, the subjunctive mood creates a third space where our ways of teaching and understanding gender are exposed as imaginary scaffolds. To stay with gender in the subjunctive is to suspend the pressure to know and ask how meaning is being organized and what compels this organization. What is demanded is a listening that stays close to misrecognition, to the missed encounter, the displacements, and partial reading through which the analyst and patient are bound to one another in the transference and remain near the force of being affected before understanding. Here is the tragedy. When we cannot sustain this movement and think within the tension of becoming, in theory and in the psyche, we are trapped in stereotypes. The stereotypes with its stereotype with its full coherence and impossible clarity is a melancholic structure. It disavows the losses of dependency, ambivalence, and difference and armors them in rigid form. Where tension is foreclosed, where the noise of fantasy is silenced, fixation, compliance, and collapse take hold. Thank you.
Thank you, Oren. Okay, just in time. So punctual. Both. Okay. I was thinking about your works, your presentations. We are receiving some questions, but I need to think to talk about some points in common between both. It's very important for me. It's a common discussion in our committee from the beginning. This challenging statement in both works about the enormous impact of the analyst thinking in the analytic situation, the definition of the countertransference as atmosphere as situation amplifies the power of the analyst thinking and the impact in the action in city, for better or for worse. The common statement in both works is about ethical position of the centering of the analyst, and I think it's very important to put the light on this analytical functioning. I have two questions for you, one for Analia and another question for Oren. We invite to the attend our colleagues to send your questions to the platform. We will try to respond all your questions with our guests. Analia, one of the questions says, does the position you take remove the notion of perversion in any form? This is one of the questions. And for Oren, how might Klein's concept of the paranoid schizoid position play into the transgender person navigation on their fantasies concerning identity? Both questions from the audience, and maybe Analia.
Analia, you want to go first, or
Could we go first?
Recording in progress.
Sorry.
Okay.
Now.
The question for you is, does the position you take remove the notion of perversion in any form? This is the question that we received for you. And for Oren?
For me?
Yes.
Yeah, because I couldn't hear the last part. I had a problem with the phone.
For you.
The category of perversion.
Yes, if you remove the category of perversion in any form, the notion of perversion in any form, from your point of view.
No, I think that it has to be reworked. But anyway, I think that the whole system of separate structures is kind of has to be rethought about psychosis, neurosis, and perversion has to be reorganized and rethought. But what I really think that is a must for psychoanalysis is to decouple perversion of any kind of sexual practice. Then we can think of, there are certain, Bernard Benoit worked on a new form of talking about perversion, which is certain subjective positions that aim at causing anxiety and partition in the other one. I mean, connected with subjective positions and not with any kind of sexual practices or lack of development or immature structures. But I think that it's a very interesting debate. No, I think that long ago, we could uncouple perversion and homosexuality. And then we had this other couple of psychosis trans. And then, so I think that the whole system of structures, then we had, it's all very much in question, as from borderline patients or ordinary psychosis in Lacanian school. I mean, the whole system of structures has to be rethought. But as to perversion, I think that we could think of other ways, but never connected with sexual practices. And I think that's why I think that in my paper, I also introduced some sexual practices that may not be familiar to us when we first listen to them, as BDMS or, things online sex and a lot of practices that maybe in Freudian times could be thought of as perverse or pathological. And I think that all of that has to be discussed. I don't want to use more time. I think that there might be more.
Thank you. Oren, do you want to say something about that?
About that particular question? Well, what is the notion of perversion that we're thinking with? For Freud, at the beginning of notion of perversion is anything that doesn't lead to to reproduction. So anything can be called perverse in that sexuality is perverse. It's polymorphous perversion. Now, to me, when I think about perversion in a way that we consider something pathological, I would think of it as something extremely destructive to myself or the other, like extreme evil is perverse. But other than that, I'm not a judge. I'm here to understand the patient and to help them understand their psychic world, not because I'm an expert, but because I can associate with them and try to explore. I'm not here to classify patient's experience into perversion or pathology. Then that's not the psychoanalytic aim. It's to open up experience, not to close it down.
Okay.
So, and it moves into the other question. I think the question that was asked of me, if I understood it correctly, it's the connection between trans and uh, paranoid schizoid position. Was that the question?
Yes, the question was how might Klein's concept of the paranoid schizoid position play into the transgender person navigation of their fantasies concerning identity?
But you see, this again, it positions the transgender as like a unique specimen. And when we talk about the depressive position and the paranoid schizoid position, we're talking about internal position that oscillates. And that of course can trans people be psychotic or paranoid? Sure, like everybody else, but it's not tied to the experience of being trans. It's not a structure. Being transgender is not a structure. It's an experience that shifts. It's not a static experience. So with my patient, for example, there are elements of paranoia, just like I have with all the other patients who are heterosexual or lesbian. Or so it's really the question suggests more about the panic, perhaps, or the collapse of meaning that happens for the person asking the question. That in their mind there's a kind of an equation between something that we call paranoid schizoid and something we call trans. And maybe, I mean, I can't make assumption, but perhaps the idea they have in mind is that there is something delusional in the experience of. I would have to understand more about the question because as it is asked, I don't understand it
Okay.
beyond what I said.
I think that it's very important to make a point in what Oren is saying. There's not a single thing as the trans.
Mm.
And I mean, I think that there are so many trans experiences, and there's not even one trans experience in a single person, as there's no, as when Oren talked about alterity within ourselves. We are not just one, we are many, and we change, and there's fluidity. And so the effort is to try to make meaning at each possible time. But
Mhm.
it's highly fluid and mutable, and
I would add to it that it's not just that we are many, it's that the non-coincidence also, the idea of non-coincidence is because there's always a gap between our fantasies of who we are and the body that we have and the situation that we're in, between the reality, fantasy, body, meaning. So all of those are gaps, and that's where the creative potential comes. What brings about the capacity to symbolize and create. So
yeah, and there is a social demand for the ego to identify
Mhm.
mhm.
themselves. But that is a social demand and an egoic demand. So it means that it is necessary at each time in our lives to say who we are, and that answer comes in terms of gender.
Yeah, it's a
But that
placeholder.
is a kind of conscious term, and the society needs us in a certain box. And so we need to identify ourselves. But that doesn't mean that there is not a big construction. Can be the conviction of a patient that thinks that she is and she was born transgender, but that is a construction.
Well, the idea of identity appears in one of our questions about your conceptualization for both of you, the conceptualization that you have about identity formation. How important is identity? Is a grasp for psychic certainty in the face of the uncanniness, or is a resort of stability in naming the self? Is something else? How how you conceptualize the identity formation? This is question.
I don't know if Anaya, you want to answer or can I answer?
Yeah,
Yes.
you can answer and then I add up.
Well, I think the question is not is identity. What was the person asking? Is if identity is useful or is it important?
Is a resource of stability in naming the self.
Well, yes, it's a placeholder. It can be a classroom, meaning it can be like a prison house, or it can be a creative thing that allows livability. But the question is not whether it's important or not. In psychoanalysis, we cannot speak about identity. We can speak about identifications, and they're unconscious, they're multiple. Um, and so when we think about what we do with the self, like we identify, sometimes it crystallizes into something coherent and something it doesn't. Or it's a creation of something new, like non-binary. It's a new category. It's still an identity. We're all caught in it because we rely on recognition by the other. But it depends on how we relate to it. Do we relate to it as something natural, fixed, static? Can we play with it? Identity always changes, even if we don't experience it as such in the everyday. The person that you were in your 20s is different than the person that you are in your 50s and your 80s. We all change all the time. Nothing is static. And so that need for an identity to be um, like a hinge or something known, something that we can regulate, something that we can police. That is an omnipotent fantasy of power because it's very the idea that identifications are not static, that we are not static, and we are very temporal, and we die, and we create throughout our life a livable space in the very, very temporal time that we're here. That is, at times undigestible for some.
Yeah, I I could say that I think it's organizing for the self, but I also think that to be able to choose or to get hold of some kind of identity, many other identifications have to remain repressed. And that's what makes it mutable. And as Oren said, it can be something rigid, fixed, or porous and open to change and to admit conflicts. So, and that is part of our clinic, to be able to hold, to wait, to give space to conflict. And also, it's the difference between our position as psychoanalysts and self-affirmation strategies that we host, and of course we accept what the patient says, but we believe there's much more to it.
I would just clarify one thing in what I said before, and I think what you're touching on is that it's not that I don't know if I was read this way, but it's not as if I think that let's say fluid identities are more open than identities that are let's say more coherent, like as a man or a woman. The fluidity itself is not the point of openness. The fluidity can also be a place of rigidity or a cluster of ideality. It's the capacity because our identifications are unconscious. We don't know how we identify really unconsciously, and we see that with patients. They have dreams in which they are the opposite sex, or they have, I mean, after all, when we think about femininity and masculinity, we're thinking about elements, not about understandable things. You know, the tension between femininity and masculinity, they're not oppositions, they're always in tension. Push, pull, soft, hard, they're elements. So when we think about, what I contrast rigidity with, more of taking gender as a holding place, is the capacity to enjoy it, that it doesn't become a persecutory place. And to some extent, it is a persecutory place for all of us. Look at the cosmetic industry. Look at the, fashion industry. We all want to be more beautiful, taller, shorter, bigger breast, whatever. But these are elements that we are also trapping, that when we can either enjoy, or can become a cluster of ideality that then, create in us. That's when it creates a paranoid schizoid experience. If I'm not
Yeah,
this, I'm that.
I think that we have to make a point in a kind of psychoanalytic thinking about identity. If we do, no, if we do make use of that concept instead of identifications, because I think that identity has long been connected with class, race, gender, no, with fixed categories
Right.
and sociologically. And that's not, if we make use of the concept, it's not for that. It's to accept, to think, as I don't know, as Pierre Lanier once said, that we always need to be able to answer the question, who I am. And because
Mhm.
society asks us for that. And also because they want to sell us things. So they want to know if we are heterosexual, we are homosexuals, we are, so the algorithm knows what to
Yeah,
send us to
yeah.
buy.
I mean, yeah,
So
yeah.
there is a social demand for identity, and that's
Mm.
also a fact.
Yeah, yes. I would call it, as I said before, it's a place of condensation. It's a place of displacement, of condensation, and all kinds of conflicts migrate to it.
Mm.
That was another aspect that I had in mind when I read your paper with I think you said something about wrapping gender as, I'm sorry, I just have to refer to it. You said something about with the case, the gender at times is a wrapping around, or the transition is a wrapping around the anxiety over the separation from the mother.
Mm.
Yes,
That in very young children, transvestism. Yeah.
yeah, I guess for me, it's the what I would what it's not that it cannot be the case. Of course, it can be the case, but it can be the case for everyone. Everyone's gender is a place of condensation, and all kinds of conflict migrates to gender, not just separation anxiety, but all genders also bind anxiety. It can be, so it's not that the trans is uniquely, I don't think of trans in any way as uniquely wrapped around the maternal body and then needs to separate from it. I think that is, there's always, gender can become a solution, any kind of gender, for separation. If we think of hypermasculinity, hyperfemininity, getting pregnant, all kinds of things can enact those anxieties. It's not the gender in other way. I don't see it as um, a wrapper around a more authentic conflict. Um,
In the sense of keep this, think about the support or sustain the complexity of the gender situation. The next question that we have, it's around that you are trying to say to us. They said, would you both consider your work as a reworking on the concept of transference neurosis that bring all the patient and the analyst transference and countertransference into the clinical space? I find you both are fighting against simplistic categorization and definition that appears to infect modern psychic life. in this sense, I think that something that you are trying to express in your paper is to keep the complexity of gender, the complexity of clinical situation, and the enormous demand of the social algorithm or structure to simplify our definitions, our identities, our transfers, and maybe in the sense of these questions, this kind of demand of simplicity could invite the clinical situation, asking for the simplification or the categorization of the psychic experience. Do you think is possible? Oren?
Yes, first of all I want to answer to Oren because maybe something was.
Sorry.
I
Yes.
really find it difficult to talk about clinical experiences I haven't had. And I'm just referring to some consultations I got from children under the age of 3, in which I found this kind of situation. And I'm not saying that later on, or I'm saying that seriously, I mean, children with difficulties also, with language difficulties, and, and so this is just limited to this experience. And I absolutely agree with you that can be any gender, even cis heterosexual genders. And I think that we are still to have much more experience on this. We have limited experience. And about, I don't know if I understood the question thoroughly, Sylvia.
Okay, I will read you again.
Can you read it again, please?
Would you consider your work as a reworking of the concept of transference neurosis that bring all of the patient and the analyst transference and countertransference into the clinical space? I find you both are fighting against simplistic categorization and definition that appears to infect modern psychic life.
Yes, I would agree.
Yes. Okay.
I would agree because I think that it brings us the social, but there's something I wanted to make clear in my paper, that I think that this experience really, in a way, is connected with my whole experience, and I don't make any difference between transgender patients or, other kinds of patients. What I really had to work on is maybe unsettling aspects. I had to work more on myself because of these differences. But nowadays, I think I am more fearful, or I am more aware when I have a patient or a client who is very similar to me, and I am more at risk of imaginarize something much more connected with what happens to me. And I think I am more able to hear and to be ready to host difference. And I think that these kinds of patients help us to be able to work and not to give anything for certain, not to give anything for assumed. And I think that it's much more risky with patients that are white like me, cis heterosexual like me. And I think that it helped me a lot with all patients. I wouldn't make, so to this question, I would say, I am fighting for all kinds of simplistic ways of considering transference and countertransference without including the social, without including geographies, without including in all cases.
Yeah, I think that yes, I agree with your characterization of the transference and the countertransference, and with the question that the person from the audience was asking in terms of complicated the concept, because it's not just what I feel about the patient. It's in a way, it's like the client's total situation. What I bring in with me, the atmosphere, it's a field between the me and the patient. And the countertransference, I think you talk about it also in your paper. It's a kind of a diagnostic tool, not of the patient, but of the analyst's own loyalties to normativity, how they're embedded in normativity in the case that we're talking about now, in the case of trans. It exposes the analyst's loyalties, fantasies, etc. I also think that it hinges also to the problem of how we think about neutrality, because to when we talk about neutrality as not just an idealized place where I just get rid of my as if I can rid of my biases or idealization, but it rather as an introspective, as a capacity to acknowledge my omnipotence, acknowledge and interrogate and be curious about how they operate now in the room with the patient. But in the same way, I think that this is something very important, not just in the clinic, but also in the institute and for the field itself, because I don't think we can talk about neutrality. We can only talk about it once we admit that the field's concepts, including concepts of gender, have been saturated historically. So we cannot really think about becoming neutral if we don't really investigate the historicity of the concepts that we use. And I
Okay.
think that's very important because we bring the institute into the consulting room.
Thank you. Okay.
We bring the institute, our analysts, our supervisors, our
Everything.
parents.
Yes.
Thank you both for your talk and your dialogue and your participation here. We have 2 minutes to say thank you. Thank you for the invitation. Thank you for the webinar committee and this nice experience for our Committee on Sexual and Gender Diversity Studies committee. And thank you, Oren and Alalia, for your papers. This webinar will be recorded in the platform of the IPA. All the attendants could file this talk from you. And thank you, Isabel Silveira, and her team for holding us and invite us. Okay.
Well, thank you for the invitation. Thank you, Oren. It was very inspiring to have this conversation. Thank you, Sylvia, for your coordination and for sharing the committee. And well,
Yes. Thank you so much for inviting me, and thank you, Analia, for a very, very interesting paper. And I'm sure that I hope that we'll engage more in conversations with you and with the committee. Thank you.
If you